In this video today, we're going to talk about anti-inflammatory diet. What works, what makes sense, and how you can use your diet and food selection to be able to improve your overall pain. If we haven't met, I'm Dr. Orlando Landrum, a regenerative medicine and interventional pain specialist who helps patients understand their options for improving their pain and getting their life back to the way that they want to be, how to be able to punch pain in the face and do the things that you want to be able to do. Today, we're going to talk about anti inflammatory diets, how it makes sense for you to use food as medicine. So, in this video, first, we're going to talk about what are inflammatory molecules. So, things that are present within your body are going to be things like C reactive protein, tumor necrosis factor, alpha and beta, interleukin 6, interleukin 10. These are molecules that cause pro inflammatory elements that will make potentially your pain be worse. And some of the things that we want to talk about are different diet selection that augments that pain for being worse. So if you choose poor diet selections, and we know them, but I'm going to name you 7 that are bad and 7 that are good. So, 7 different foods that can certainly worsen your inflammation. One would be things like potato chips, pretzels, also hot dogs, beef jerky, donuts, soda, margarine, dairy products. The top 7 anti inflammatory products are going to be things like berries, salmon, broccoli, avocados, green tea, cherries, and bell peppers. Those food selections and choices can be able to improve your overall pain. So, in some studies that looked at specific pain types, have an understanding about anti inflammatory diets. The first study is one that is the inflammatory potential of diet and risk of incident knee osteoarthritis. To get understanding about diet and inflammatory markers, is one that is the anti inflammatory diet and rheumatoid arthritis, a randomized controlled crossover trial indicating effects on disease activity. And you change certain elements of your diet, you can influence different pain states. So when you look at fibromyalgia, that study showed that if you pursued a gluten-free option, you use some probiotics, and you use the aspect of refraining from MSD, it ended up improving patients' overall pain. For patients with low back pain, they saw that individuals who did vitamin D3 supplementation, they had a calorie restricted diet, and they had high protein, ended up improving their overall pain. For those patients that had knee osteoarthritis, if they used some elements of uh, blueberry polyphenol supplementation. So they took in blueberries and they did it with probiotics, and they had vitamin D2 and D3 supplementation. They saw some degree of improvement. For those patients that have chronic headache, one of the things that they looked at was a very low ketogenic diet that had fatty acid supplementation with also omega 3s added to the diet, ended up improving their overall pain. Those patients who had neuropathic pain, so things like diabetic neuropathy, they were found that if they really switched over to a low-fat, plant-based diet, that they had improvement in overall pain, particularly if they had that in conjunction with vitamin B12 supplementation. The other elements of traditional chronic abdominal pains, where one has either lactose intolerance or irritable bowel syndromes, first, if they used low fat diets and they eliminated lactose, um, or they added the aspect of probiotics in the right context and increased their fiber, they ended up having improved pain. So all of these things are ways to be able to decrease your overall inflammation and be able to improve your pain so that you can get back to leading your life and do the things that you want to do. Question of the day: what diet has helped you improve your pain, and what diet and different things that you eat seem to worsen your pain? Please include in the comments below. If you feel like this video has given you value and you'd like to see other videos like this, please hit the subscribe button so you can learn more about how we can help you punch pain in the face and get back to leading the life that you deserve. Thank you.